We begin this hour with a gut-wrenching pandemic dilemma that is looming in the hospitals of Canada's biggest provinces, where healthcare systems are creaking under the strain of patients requiring critical care. There are right now more than 4,800 Canadians receiving hospital treatment for COVID-19, almost two-thirds of them in Ontario and Quebec. Nearly 800 patients are in intensive care units, again, the vast majority in Ontario and Quebec. Stretch teams in some hospitals are working now on dry runs to determine which patients receive critical care and which don't. Triage protocols that will become potentially life or death decisions. Alison Northcott leads off our coverage.
Officials in Quebec and Ontario have been warning hospitals are nearing a critical point.
Our healthcare system is at risk here.
Now they're preparing for the worst, with tools ready to help medical staff make unthinkable decisions around who should get critical care if ICU capacity runs out.
Even reading the protocol turns my stomach. I mean, I understand it. It's based on saving the most number of people, based on their overall likelihood of surviving. So the spirit of it is good, but I've never had to make decisions like this.
It hasn't come to that yet, but critical care staff in both provinces have been told to prepare.
It is contrary to everything that any physician, I imagine, has ever been taught.
The Quebec protocol involves a 3-person team in each hospital.
You get a score that reflects your chance of survival. And the ethical principle behind it is, of course, to maximize the benefits, to save the most lives, and so the patient with the best chance of survival will be prioritized.
But it all brings up so many ethical questions.
You can't decide who lives and dies by a memo from the government.
David Lepofsky is an advocate for people with disabilities. He spoke out against an earlier version in Ontario from the first wave that was later rescinded. He's still worried this kind of triage could lead to discrimination.
It's wrapped up in a bunch of medical language, but it still risks serious discrimination against some patients with disabilities.
Quebec changed its protocol after similar complaints. Ontario's says the approach aims to prevent bias, while doctors in both provinces say they hope the situation they're preparing for never happens. Alison Northcott, CBC News, Montreal.
Another doctor's experience. Now, last hour, I was speaking with Dr. François Marquis, who is the ICU chief at Maisonneuve-Rosemont Hospital in Montreal. He says his own facility could be a week or two away from having to implement this new triage protocol, and he explained the system of scoring and what the system involves.
If the patient is in renal failure and needs renal replacement therapy, the amount of days that the patient was put on the vent, if the patient needs special medication to support blood pressure, antibiotics, other diseases, what that we call comorbidities, like do you have a cancer on top of everything? Do you have like severe diabetes? And all that put together gives you a score, and this is sent to a 3-person committee that doesn't know about the patients. You have no names, no pictures. There's no way you can know if the patient is like mentally handicapped, if the patient has, whatever gender or color or religion. You don't know about that. And this committee will recommend continuing ICU or not.
When you get that score and it goes to the committee, and can you just clarify for people, will they look at the number and is it higher number or lower number depending on where you are? You might be higher, somebody lower, and then the decision is made whether you get the care or somebody does. Is that what happens at that point? Can you take us through that?
Yes, and also it could be, do we withdraw the care? Because it's not because you're already in the ICU that you're protected. It's not something just for the newcomers. When we start that, we actually score everyone in the ICU. So someone already, for example, there's one part of the score that is related to being intubated previously for more than 21 days. That is very, very important. So for example, you are on the vent, it's day 25, and you're not improving, well, we can actually remove the ventilator. So, it's not just for the newcomers. So it's something to think about too. You may already be in the ICU and we will withdraw the care.